Where does sitting and back pain matter when I have a patient in front of me? If the research suggests there's no relationship between so-called bad sitting posture and back pain, should I ever focus on it with my patient? I don't want to spend this entire video going over the evidence around the lack of relationship between posture and back pain. But to summarise, when we look at a population level, there is no agreed standard of good posture. And research shows that there is also no relationship between the alignment or curves of the spine, asymmetries, the way we sit and our time in sitting, and the development and continuation of back pain. So should we throw out even asking about sitting, assessing it, or even intervening with a person with low back pain? Well, let's be discerning about where we spend our time and energy looking at sitting. So let's look at a couple of scenarios where it might be relevant for our individual patient. The first situation where sitting may be relevant is for the patient with a clear relationship between the way they sit, their sitting, and their development of pain. There should be a clear story here, maybe a new job, a new office, maybe they've started working from home and the way they are sitting is something that is new and unaccustomed. And there's a clear relationship between this and their pain. Obviously, there will be other factors that have contributed to their pain, but we are looking for sitting to be a clear contributor. If this history is really clear, having a look at how they sit, and if you can make some noticeable changes to their symptoms through trial and error of a different position and habits, would surely be part of their management plan. The other situation it would be relevant is when someone is having to manage severe or acute low back pain, where they need to sit for short or long periods as part of their occupation or other social requirement. Of course, posture may not be at all responsible for the onset of back pain, but finding ways in which they can sit more comfortably, potentially in a more supported position, may be the difference between someone getting back to work or not, which can really impact their recovery. So in these two situations, it's likely helpful to ask the patient to show how they are normally sitting, obviously acknowledging that this won't be how they sit all day, but we may be able to provide some changes to what they are doing as part of our management. Get the patient to trial a few different ways of sitting and perhaps adjustments to their chair so they are more comfortable. Upright sitting with a neutral spine, although it might be a simple place to start, might not automatically be the best position for everyone, but doing so with a supportive chair may be a helpful place to start, and then we can make some adjustments from there. Being curious as to what changes in position might be helpful for the patient is the way to go. We want to help guide them to find what works for them. But let's put this all into perspective. Other factors are incredibly important in someone's development and experience of pain, and potentially their recovery too. Sleep deprivation, stress, and social factors, to name a few. If sitting is an issue for the patient, strategies to change position frequently and integrate physical activity into the setting they are in may be far more helpful in your overall management.